Welcome. My name is India Nielsen-Barfus, and I'm a program manager in the Utah Office of Outdoor Recreation. Thank you for joining today's Summit Speaker Series on creative strategies for health and wellness. We're going to be learning about several programs around the state that are integrating the outdoors into strategies for community health and wellness, and we have some amazing people to present to you today. I am going to introduce today's speaker. We'll hear a brief presentation from each of them, and then in about 30 minutes, we'll open up the question and answer session in the chat. So first of all, this morning we have Mercedes. Mercedes completed her bachelor's degree in health promotion and education with a community health emphasis in 2019 from the University of Utah. She currently works as a health educator in the Salt Lake County Health Department's Healthy Living program, where her focus of work is on active transportation and safety around biking, walking, and public transportation use in Salt Lake County. Mercedes has a passion for public health and connecting people to safe and equitable opportunities in the active transportation world. Next, we're going to be hearing from Andrea, who is an assistant professor for Utah State University Extension in Washington County with assignments in family and consumer sciences and 4-H youth development. She earned a master's degree in recreation management and youth leadership from BYU and is passionate about the benefits of outdoor recreation. Andrea strives to utilize innovative programming in her work with youth and families of Washington County to teach sustainability, youth development, and healthy living skills. And to wrap up the presentations, we're going to be hearing from Sarah Kinnison, and she earned her bachelor's degree in health science with an emphasis in public health from Brigham Young University, Idaho, and currently is working toward her Master of Public Health from Utah State University. Sarah currently serves as the Healthy Living Health Educator for the Salt Lake County Health Department, and her position primarily focuses on diabetes management in Salt Lake County and promoting promoting physical activity through park prescriptions to decrease the impact of chronic disease. Sarah has served as the program director of ParkRx Utah for 3 years and is passionate about creating opportunities for better health in disparate populations and connecting people to the outdoors to improve their health in innovative ways. Thank you so much for all being here and offering your expertise and your words of wisdom today. As I mentioned, we're going to start with Mercedes, so I will turn the time over to you.
Thank you so much, India. So as India mentioned, I am the health educator over active transportation for Salt Lake County Health Department. And our whole team focuses on chronic disease management and prevention. So I often collaborate with other local health departments and health districts across the state to get more information about how we can make these programs more successful statewide. And so today I'm going to share with you a few of the unique programs and activities that we do to get people outside and moving. So before I jump into what activities we do, I just want to start off by talking about what active transportation is. So the CDC defines it as any self-propelled human-powered mode of transportation. So this includes walking, all cycling forms, and even use of public transportation in conjunction with walking or cycling. So with physical inactivity being a major contributor to the steady rise of rates in obesity, diabetes, heart disease, strokes, and other chronic health conditions in the United States, active transportation is a great way to add physical activity into the daily routine to get to a destination that has already been planned. So here in Utah, more and more people are actually turning to active transportation for commuting and recreational purposes. So nearly 45% of Utahns actually get less than 150 minutes of the recommended physical activity each week. So some fun statistics that include Utahns could save $3.07 in annual healthcare costs for every mile that they walk, or 75 cents for every mile that they bike. So if someone were to walk 2 miles a day for every single day of the year, the average savings of healthcare cost is $2,235. And similar for someone who rides their cycle for like 10 miles a day would save about like $3,000. So it really does pay off to get outside. Some people get kind of nervous though about active transportation. Many people view walking and biking within their communities unsafe due to heavy traffic or scarcity of sidewalks, crosswalks, and bicycle facilities, which is also a concern in the rural parts of our state. And so my job is to assist in making communities aware of how they can better the infrastructure in their communities for biking and walking. I have to provide opportunities, though, for the community to be heard, because I'm only one person and I live and work in the most populous county here in Utah. And so I heavily rely on the community to provide me with information about the places that they walk and bike, and to make sure that they're my eyes and ears as well. So one way that we do this is through an activity called video intercept surveys. So people that are already out and walking in their communities, we reach out to them and provide them with a series of questions, and they answer these questions in a video form. So pre-pandemic, I would go out to certain areas of concern in different communities within Salt Lake County and just walk up to people who are walking to the bike or to the bus stop or biking down the road, and just approach them and say, hey, like, can you tell me about your experience of walking or biking in this area? And then I would record a video and we would have a conversation. But during the pandemic, people did not want a masked up lady from the health department chasing them down to answer a bunch of questions. So I kind of got a little bit more creative, and now this is a way that many different health departments across the state conduct these surveys. So we reach out through social media, we do contests or different things like that where people can share their insight, answer these questions in a video form, and then I compile all of that information and share it with communities and city leaders. And so then the information that I share with city leaders then turns into, hey, this is what you can do to, help improve walking and biking in your community. I found out quickly that people are really willing to share their thoughts, but just need to know how they can share their thoughts and how they can get that across to their city leaders without being a part of a city council meeting if that's not something that they're comfortable with. So I have had many city leaders then contact me after I've sent out this information, and they say, hey, come out to our community, let's see these areas of concern. And so we walk together and conduct a walkability audit. So this is the second activity that we do. We invite community members, we invite whoever wants to come, and we walk and talk about the different things that could be different in the community to make things safer. So we ensure that the sidewalks are the suggested width. We make sure that the crosswalk button is accessible for all users, that it's a perfect height. And we have them watch the traffic and speeds during different times of day so that they can physically notice the concerns that the residents are having, and then they can address them. It's also a fun way for them to kind of get outside, walk and talk with community members as well. We often do these walkability audits around schools, and we assist with the Safe Route to School mapping program. So Safe Routes to School programs across the United States are associated with increased active transportation, including an increase of number of students walking or biking to and from school. So over a 3-year period, a comparative analysis based on a national sample of school Safe Routes to School programs found that Safe Routes to School was actually associated with an increase of a percentage of students who walked to school from 7 to 8% to about 15 to 16%. And then an increase of percentage of students who biked to school from 1% to 2%. So even though it's small increases, it was something that's available to all students, and it's increasing them getting outdoors more. The Safe Routes to School program is offered across the entire state of Utah, and it's actually especially helpful in the rural Utah areas where sidewalks aren't always available. And so this program helps the community and school administration kind of come together and find a route that's the safest and quickest way for the kids to get to school. So we encourage walking and biking to school, but we also want to make sure that safety is a priority. And so by improving the environment for walking and biking, Safe Routes to School is also contributing to increased physical activity among adults and reducing injuries involving pedestrian and bicycle collisions. So under Utah law, all elementary and middle and junior high schools are required to create and distribute this Safe Routes plan to show the safest route to school. This is a huge deal for the schools around the state to ensure safety and work closely to make sure that the kids are safe coming to and from school. They're not just concerned about when they're in the school, but they want to make sure that to and from school, they're also safe. So we work really closely with school administrators to find the safest route, which usually includes the least amount of intersections, areas that have a lot of crosswalks or crossing guards, and the least busy streets. And then we create an online map that allows parents, teachers, students, community members, whoever really wants to access it, they can see what route they should take to the school or surrounding areas. So if there's a park nearby, something that is a safe way for them to walk to the park as well. So another piece of the Safe Routes to School program is the Safe Routes Utah Beat the Street Assemblies for elementary school age students. So local health departments around the state have teamed up with Safe Routes Utah to teach 2 different assemblies, one for 1st through 3rd and one for 4th through 6th. And students learn how to safely cross the street by learning where to stop, how to look both ways, what to do if a car is parked in the way and they can't see around it, what to do if there's a driver in the car, and how to make eye contact with them, how to properly put on a helmet, what a reflective gear is, and just a lot of different safety features to make sure that they know how to get safely to school by using their Safe Routes map, but also when crossing the streets. EMTs also teach the older kids about pedestrian and car collisions and how to avoid being in a tragic accident. So it's important for us to really teach kids at younger ages the importance of safety, as well as creating these healthy habits to get them outside during this critical time in their life to get outside and walk or cycle and find a love for those things. So although these programs obviously look very different and serve very different populations around the state, all of the health districts work really hard to ensure that safety and physical activity are a priority to the communities across the state. And they do so by advocating for the safe infrastructure and educating those to help cyclists, pedestrians, and drivers alike to share the road and be safe. So I am going to leave my information in the chat today. And if you are interested in any of these programs or want to be included in having your voice heard by community leaders, please reach out to me. I'm happy to connect you, even if you're not in Salt Lake County. You can complete a video survey, or I can send you information about a walkability audit so that you can, and I can get you in contact with your health district's active transportation contact. So thank you so much.
Thank you, Mercedes. And I will make sure to send out all of these resources, including contact information and things like that after the fact to everyone who's registered. I'm going to put a little message in the chat as well, just so that it pops up for everyone. I just do want to kind of highlight a few things that you mentioned, Mercedes, in terms of having a super community focused program, and getting people who are actually using the active transportation or the outdoor infrastructure to get from point A to point B, talking to them and then taking that to community leaders is fantastic, as well as having a huge focus on safety, particularly with the Safe Routes to School programs, and knowing that kind of introduction to outdoor time, to activity outdoors with the walking and biking, can be one of those things that may really stoke that love of outdoors and physical activity in folks at a young age. So I loved learning about all of that, and thank you so much. And Andrea, I'm going to go ahead and turn the time over to you.
Okay, thanks a lot. I'm going to go ahead and share my screen so you guys have something a little more fun to look at besides me. Let me make sure I do this right. Okay, do you guys see a John Muir quote with a picture?
Looks great.
Okay, awesome. Well, I loved what Mercedes talked about. It's a great segue into one of the programs I wanted to highlight here in Washington County. First, I love this quote: "In every walk with nature, one receives far more than he sees." I can't overemphasize the value of being outside. I've seen the impact it's had on so many people in different phases of my life. I used to be a river guide. People would come out, and it was interesting to watch the transformation as they spent time outdoors. But one of the programs that we do here in Washington County, I'm on a Healthy Dixie Coalition, the Healthy Dixie Council, and I wanted to highlight this first because it ties in a little bit to what Mercedes was talking about. But it's called Writing for Focus. And just this last year, it's been in the process for about 2 years. The Healthy Dixie Council consists of community members. We have the health departments represented. I represent USU Extension. We have people from the local bike shops, anybody who just wants to see our area become more healthy and promote programs to do that. And one focus has been active transportation. But we were able to help one of the local schools implement this program called Writing for Focus. And it's a program that's done with the Specialized Bike Company, and it's based on research that they did with, I believe it was Stanford. And what this program does is it introduces biking to kids in schools. When you join the program, you commit to offering biking activity outside for kids. It needs to be 3 days a week for 6 weeks and about 30 minutes a day. But they do recognize that different schools have different time constraints and things like that. But what I love is they offer training. It's a full PE, physical education curriculum, and they offer teacher training because they did find that research showed them that kids who spent time outside, especially biking, had better attention spans, were better able to focus on their work, and they just found that there were some real positive benefits. So that's one thing that we're doing here in Washington County. We're working on getting that program into other schools. We've been talking to the Washington County School District, and we're trying to overcome a few barriers there. But there's grant funding you can apply for. We did grant this school some grant money that we had received. And anyway, it's a fantastic program. In talking to the students and the teachers, a lot of success there already. And a couple of students had never even been on a bike. And so it was interesting. We went out and visited the school, and it was interesting to watch the youth who were used to riding bikes help these youth who had never been on bikes and teach them and learn. And just it empowers them, and they just come away feeling like they can do things. And so, which to me, the whole health and wellness thing, it's not just physical, but it's mental, it's emotional. And programs like this address all of those different components. Another program that I'm super passionate about is in doing some research and recognizing that intentionally designed outdoor programs can create a system for building resilience, and knowing that resilience is a key component in helping both youth and adults thrive in today's economy, especially with the COVID pandemic this last year and some of the challenges we've all faced. We've decided to focus a lot on providing more intentional outdoor programs. And so I had a couple of volunteers that actually approached me and asked if they could help me do this once they learned I was considering it. And so we've started what we just call the Outdoor Adventure Club. And I have colleagues throughout the state who are doing similar programs, and so we're trying to collaborate a little bit. But we just want to introduce outdoor activities to these youth so that as they grow up, they realize that it's available, that it can be done without spending a lot of money. One of the barriers to outdoor activity for a lot of people is they think it costs a lot of money. They don't know where to go. They don't even know how to approach some of these things. And so with our Outdoor Adventure Club, we're focusing on youth that are between 10 and 13 years old right now, because we thought if we can teach them those things and help them gain a love for the outdoors, as they hit those older years when they're able to drive and they start having friends who are influencing them a little more, they might be able to encourage others to incorporate those same activities into their lives. One thing that we've done is we've actually provided leadership opportunities for each of the kids in the club. We have a couple of historians, they take pictures, and we have a private blog just for the families that are part of the club. And it's up to those youth to put information on the blog about what we did, where we hiked, what was the weather, what were the things they learned. We have a vice president over safety and first aid, and they teach little first aid. Oh, let me change the slide so you can see this. Okay, so this is one of the hikes we did. We try to take them on local hikes. That's our focus this first round of the club, is on just getting them out and hiking, showing them things they can do without having to buy a lot of equipment. So the picture where you see the kids sitting down and there's two students standing there, they're actually doing a little first aid lesson on hypothermia. And it was a great day because it was actually chilly for here in Washington County on that day. This was just a couple weeks ago. But teaching these kids in an outdoor setting, they seem to be more willing to learn. They're able to apply the knowledge that they're learning. And what I've noticed is by giving them these little leadership opportunities, we're addressing the overall health and wellness. They're learning public speaking without realizing it. They're learning to interact with kids they didn't know. They're developing connections and friendships, which all contribute towards building that resilience that we want them to have as they face so many of the things that are part of life nowadays. Um, then another program that we're just now working on bringing to the state of Utah, but it will be based here in Washington County, is called Becoming an Outdoors Woman. I've been doing several site visits with a few volunteers who've jumped on board and want to help plan this. But Becoming an Outdoors Woman is it's an international program, and it was started at the University of Wisconsin when a professor there discovered that there was a gender gap in some of the traditional outdoor activities such as hunting and fishing and some of that. And so I went and visited one of their programs in Wisconsin and came away just more determined than ever that Utah needs this. We actually had this program it ran in Utah between 1995 and 2004 and was sponsored by the Department of Wildlife Resources. I've reached out to them. They were not able to continue it at that time, but they still have people reaching out to them asking, hey, when are you going to start this back up? What I love about it is it creates partnerships between a lot of the state resources, the Department of Wildlife Resource, Department of Natural Resources, Fish and Game. The whole purpose is to bring these different organizations together to teach women how to be comfortable in the outdoors. It also involves the industry leaders and different outdoor gear companies. And we tried to provide a learning environment that's non-competitive and supportive for women so that they can gain confidence in the outdoors and not only gain confidence for themselves, but also confidence in being able to take other people outdoors or allowing their children or their friends or their spouses or partners to do outdoor activities without needing to worry. There's some great success stories. The women I interviewed when I attended the one Becoming Outdoors Woman program in Wisconsin, some of them had never done anything outdoors. Their husbands hunted or fished, and they wanted to kind of get a feel for what it was they did, and they come away feeling empowered. And my goal with this is if we can reach the women, if we can help women feel comfortable in the outdoors, the effect that women have in their community, it just becomes this ripple effect, whether they're mothers, aunties, grandmas, leaders in their local community, teachers. If they can gain that confidence and see the benefits of doing outdoor activities, then that will trickle down to all those people that they influence. And so we are hoping to get that up and running. We're going to offer what they call the BOW, short for Becoming Outdoors Woman, workshop at the end of February in 2022. It seems a little ways off, but it's a big undertaking. We'll be offering 1/3 of the courses, the workshops that the women can take will be hunting related, 1/3 fishing related, and 1/3 what they call non-harvest, and basically any outdoor related. But that can include how to back a trailer, how to drive a trailer, how to clean your fish when you fished, how to car camp, basic first aid for the outdoors. It's a wide variety. And so that's where my passion lies right now because I've seen what that has done. I'm going to stop sharing now. But I've seen what that has done with women in other states, and it will be a statewide program. So as soon as we get up and running, India said she'd help me get the word out to people who've been involved in some of these workshops and different things. But I really feel like if we can reach the women, they provide volunteers to our other programs. And like I said, the trickle effect, just that support in our communities in our state to help build the resilience among youth and families. And I'll make sure you have my information if you're interested in any of that. And India said she would send that out as well. And so I appreciate the opportunity to share some of those programs with you guys. Thanks.
Andrea, thank you so much. I feel like every time I talk to you or hear from you, I learn about something else that you're working on, and I always love to learn more about your projects. So thank you so much. I think a couple things you mentioned that were super interesting is in terms of resilience. Obviously, that you mentioned that the kids can gain from these different programs and being outdoors and things like that. Obviously, resilience is one of them, but also that attention and focus, the empowerment, the confidence, the ability to learn those mentorship skills and different public speaking skills and just everything like that. It kind of shows just all these different opportunities that kids and families and people can have by learning skills outside that are probably very focused on something outdoors like riding a bike, but can translate into a lot of things. So thank you for highlighting those and thank you for your work. With that, Sarah, I'd like to turn the time to you.
Awesome. Thank you. And Mercedes and Andrea, I've loved hearing everything that you have shared and learning more about the programs that are in the state. It just makes me even more excited about the work that I focus on with ParkRx Utah. So I want to start off with what is ParkRx, if you haven't heard about this concept before. So ParkRx is the prescribing of parks and other protected areas to patients in the clinical or community practice settings to promote and encourage physical activity. So you don't need a medical license to prescribe parks, but traditionally a park prescription program can be seen in a doctor's office. So we term ParkRx as a general term, but that could be any green space or any reservoir or anything like that. We just want to get people outside and prescribing outdoor time. And so what we like about the outdoors, and I'm sure that you all can agree, is park outings or any other green space outing. They're convenient to get to. They're inviting and reliable. They're something familiar to most people. They are free of cost, which is probably one of my favorite reasons, because that's a huge barrier for people not getting outside or even just exercising. They can accommodate the ability level of a patient, and they provide opportunities for regular engagement. So something that I think about is that we all know that we need exercise, but as Mercedes mentioned, the majority of Utahns aren't getting their physical activity in. And so this park prescription program allows for a specific experience and a specific prescription for a patient to follow through to exercise. So what are the benefits? And we've touched base with the previous speakers about what the benefits of not only physical activity, but physical activity outdoors. So there are physical and mental health benefits when it comes to being active outside. So for instance, diabetes patients have better blood sugar control. Hypertension patients, they see a decrease in their blood pressure. It also helps with suffering from cardiovascular, respiratory, digestive diseases. And there's actually studies done that when someone is being physically active outside, the benefits for their mental health and mental well-being are greater than when they're being physically active indoors. So that's what I love about the outdoors. But also to touch base on that, spending time in nature is also associated with lower levels of depression, anxiety, and stress, which we all know we have a major mental health crisis here in the state of Utah. And so this could be a major tool that can be used in our state. And like I said, traditionally you can see it in a doctor's office. So I can use that as a general example just to get your ideas of what this actually could look like. So say a patient with diabetes goes to see their doctor and they tell them, hey, yeah, I haven't been exercising at all, or I need some new ideas. The doctor can go to a program that we partner with, ParkRx America, and they have a database on there where we are currently adding all the parks in the state of Utah. We don't have all of them yet, but they can type in the patient's address. They can find parks from a quarter of a mile to 10 miles away, and the doctor and the patient will discuss what park best suits their needs, or which one they would like to go to. And then a doctor will fill a prescription saying, okay, you're going to go to, or the patient and the doctor agree that they're going to go to the park twice a week. And for 30 minutes, they're going to walk around this park. And then they'll receive that prescription either through a text or an email through a link. And when the patient goes to the park to fill this prescription, they will just click that link and fill it. So that's essentially what it looks like. So ParkRx Utah. So that is our coalition that really focuses on getting out, prescribing this outdoor time to all Utahns. So how did we get started? I heard about this idea a few years ago, and I was really surprised that we didn't have a program here in the state of Utah, just because obviously we are very enthusiastic about the outdoors. And as I have a public health background, I thought it was a perfect fit for me to work on this. So as I started researching this for a year, the more and more I learned about this, I realized I needed more help. I couldn't do this just with my public health brain. I needed help from other partners and other expertise. So that's when we started ParkerX Utah, where we had, I think, about 6 to 8 partners from different sectors. So we had people from the healthcare world, public health, Parks and Rec, just a little bit of everything. And we just started brainstorming, deciding what we want as a ParkerX Utah program, and how do we get started. And as we continue to discuss this, we realized, okay, there's a lot that we still need to work on, and there's a lot that we can do, and because we do want to make this a statewide program, because it's going to look different in an urban area than a rural area, and activities are different in these different areas. And so through the years, we have grown to a coalition about 30 people, and through networking, connecting, that's been our biggest strength, I think, just because when you get all those different perspectives, you really learn about all the different amazing programs that are out there. And also people have connections, and we are currently trying to pilot programs this year, especially in clinics. And so that's something exciting that is going on in 2021. So where we are at now, we do have different work groups that focus on different areas, just because, like I said, when we started working on ParkerX Utah, we realized there are so many things and areas that we can focus on. So our community work group, we focus on promoting the wonderful programs, which I'm sure many of you are a part of, which already exist, and prescribe these programs to patients. So we are creating a community resource guide throughout the state that we want to promote your programs. And so if you have anything, let me know. We would love to highlight you. And then our mental health group, which India actually leads, they are reaching out to mental health clinics, and we're trying to, this could potentially be something that therapists can prescribe to their patients without medication or with medication. We just want to see everyone's mental health improving by going outdoors. And then our clinic team, we are, like I mentioned, trying to pilot the ParkerX program in some clinics. We're starting in Salt Lake County, but if you have a clinic, or you know a clinic that would be interested, or if you know a doctor that would be interested, let me know. We would love to work with them. And then our marketing and outreach team, we do a lot of outreach, connecting with new people to join our coalition, and also highlight the amazing programs that are out there. And so Mercedes actually runs our social media pages, and she's always looking for programs to highlight. So if you have something that you would like us to share on our social media pages, please let us know. It's just ParkerX Utah on both Facebook and social media. That's my little plug here. And with that being said, we also have something very exciting. So today is April 13th, but on April 15th, this Thursday, we are starting a statewide contest for 10 days because it's ParkerX Day this Saturday, April 17th. And we want to do something to celebrate that and try to get people outside. Our big motive is because of COVID-19, a lot of people have been forced inside and maybe have not taken the opportunities to be outside, and especially also because winter, we're entering spring. And so we're trying to get people out of the isolation and do some outdoor exploration. And so make sure you're following ParkerX Utah on Instagram or Facebook for more details, or you can go on our website, parkerxutah.org, for more information. And if you would like to promote this on your own social media pages or with your team, or if you just want to participate, but we also do have partner kits. So if you want to promote it, we came up with some social media posts that it's easy. You just post it. We have the caption, the picture, and you just post it on your social media. So if you're interested in that, I can make sure India sends that out to everyone, as well as my contact information if you want to learn more about ParkerX or how you can be involved.
Terrific. Thank you, Sarah. And I'd like to remind everyone in the audience now, if you have questions for any of our three speakers, please feel free to put them in the chat. I do have a couple questions that I'm just going to get into, and these are open to any of the three of you, so feel free to just jump in when you're ready. But one of the questions I have is, what are your recommendations for launching any one of the programs that you mentioned? Because obviously we had everything from Safe Routes to School to becoming an outdoors woman to the Park RX Utah chapter. So what are your recommendations for launching a program like this that can have those community health benefits?
Like I mentioned previously, my biggest advice is getting people with different expertise. So you might think, okay, outdoors, we just need all the outdoors people, but it is beneficial to get people who maybe in public health or in nonprofits, just that they have different experiences and knowledge that you would never think, or they just have that outdoor or that outside knowledge that they might have that idea that you really need to get moving. But also that support is super helpful. We had support from Intermountain Healthcare and the University of Utah, big organizations like that, that I had no idea they would be interested in a program like this. And having that support has been super helpful. And then my last thing is connecting with the community that you want to serve, hearing from them, finding you can do focus groups or just surveys or something like that, like Mercedes does her video intercepts. Learning from the community themselves, you'll gain so much knowledge and build a program that actually suits their needs.
And can I just add to that? I failed to mention that our Outdoor Adventure Club is a 4-H based club, which 4-H, their whole philosophy is learn by doing. But what has fascinated me, my colleagues have told me all along, you can find some good volunteers, and I was a little discouraged. I'm like, well, how do you find them? But with this Outdoor Adventure Club, I have found some key volunteers because they want this for their kids and their families. And what has fascinated me is they're coming out of the woodwork every time we go on a hike. I usually have 3 to 4 parents who will come along. And because I specifically asked not for them not to bring other siblings, because I want these kids to feel like this is about them and this is their club, I have volunteers now asking me, hey, can you do it for a little bit older kids? I'll help you. And then I'm able to talk about this becoming an outdoors woman thing, and several, even the men that have come along. Hey, I know people that will want to do that. So it kind of creates that network, that web among people that I wouldn't be able to reach alone. One of the parents of the kids in our club actually is a professor at Dixie State. So it's opening the doors to collaboration between universities. And it goes back to the support that Sarah mentioned. But I really think if you can find those key volunteers, they'll help you keep that going, and they'll reach the people you're not able to reach, because it's real people reaching other real people, not just people listening to me because it's my job.
I would also add too that because a lot of the things that I do involve the community members, is just gaining that trust of, I'm not just someone who works at the health department, but I'm also someone who cares about you and someone who wants to make things better for you. Just building trust with the community, but also with Safe Routes to School program, building trust with school administration and making sure that what they need and what they want for their students is met.
I think one pretty common theme that we just saw through all of that is simply a network, and making sure, if you don't have that person who you'd like to contact, or maybe you don't even know, this role that exists in some other entity or organization, it's great to have that network. It's great to have, obviously, the community buy-in, but it sounds like, maybe once you've got that community buy-in, you have more than you initially thought you did, particularly Andrea, with the example that you just mentioned. That's fantastic to hear. What would you say, or maybe, and I know you've kind of touched on this a little bit already, so if you could just expand maybe a bit more for people in the audience who are thinking about maybe doing something related, obviously, not necessarily the same things, but what are some of the challenges and also rewards that you've seen in any part of your different work and what you do?
I think one of the challenges that we have faced, the reason that we've been working on this for so long, and we don't really have a lot of, we are barely starting our pilot programs, is it can be very overwhelming. And so the challenge of so many different ideas it's a great thing. It's a blessing and a curse. And so that is a challenge that may come up. You want to make sure it's perfect, but I think you really just have to go with it and just learn from, you want to build a good foundation, but realize that you're just going to have to go for it and learn in the process. And the rewards, I think it's just seeing people, I mean, I think everybody might agree with this, is just seeing people learn a new hobby or realizing they connect so well to the outdoors and them actually experiencing the physical and mental health benefits.
I think what Sarah said is spot on. In there's so many opportunities. It's trying to narrow it down, and so I think I have to continually remind myself to start simple, because for people who've not done these things, it can overwhelm them as well. If you just say, "Hey, we're going to go rock climbing, and we're going to go hiking, we're going to go pack rafting," whatever, they're like, "Whoa, slow down." But starting simple and just I totally lost my train of thought. Oh yeah, and then looking for ways to integrate other things. Like, we have incorporated the Every Kid Outdoors challenge. I think it's 10 activities, and we actually printed off the little passport, sent it home with our kids, and then sent a note to the parents saying, "Hey, you can be part of this club among your family." Each time we meet, we ask them, "What did you do with your family?" And or your friends, we try to not single anybody out if maybe they don't have that type of situation that they can do it. But the kids get so excited, and then they tell us, "Well, I told my friend about it. Can they do this passport thing?" And India tipped me off that if they mail them in, they can get a prize. So the kids are working toward that. And at our last meeting, several of them said, "We only have 3 more to do. We just did 3 in this activity." And they're looking for ways to incorporate it. And it's kind of bleeding out, right? So we kept it simple by focusing on the hiking. But as I learned what these families are incorporating as their youth bring this home, that's really empowering and encouraging to me, because we can grow it. I just have to remind myself to do it slowly so that we don't overwhelm not just me and the volunteers I have, but the families we're trying to reach.
And I would just add, something that is challenging for me is being in Salt Lake County. There are lots of different needs and lots of different things. So being innovative enough to make sure that everyone's needs are being met, especially when it comes to equitable opportunities for biking and walking and public transportation and stuff like that. But the most rewarding thing ever is to do assemblies at schools. Those kids soak up all of that information and they love it and can't wait to get home and teach everyone about crossing the street and being outside. And I think that that's where it's so important to make sure that they have a love for the outdoors.
Wonderful. Thank you all. I know we're just at about time. I just want to mention, since we brought up kids and specifically Every Kid Outdoors program, if anyone's interested in having that passport for their kids or kids in their neighborhood, business.utah.gov/outdoor/EKO for Every Kid Outdoors. That's something that I know in our office is we've made Every Kid Outdoors this reality in the passport program and in other ways as well, as that it has also been pretty overwhelming, and we've had to, kind of, like you said, Andrea, start simple and make sure that we've got really actionable steps along the way to make Every Kid Outdoors a reality for every kid in Utah getting outdoors. So I just want to thank you all so much one more time for being here and offering up your words of wisdom. We really appreciate it. And thank you to the audience for tuning in. I'll make sure that we send out all the resources that we mentioned to anyone who's registered. This video will be posted on YouTube. I'll send that out as well. And with that, I just want to thank you all again so much. And I hope everyone has a great day.